know that the cost is just increasing day after day.
If your total bill is 1,000 dan daripada 1,000 tu 5%.
What if the medical bill is 100,000?
Sekarang ni dah ada banyak penyakit baru.
One of the thing is, okay, it will continue to go up.
Tapi at the same time, you cannot also compromise the cost.
Medical field ni pancreatic cancer
Bersama saya Dr. Roland Victor.
satu benda yang one of the worst stress can happen bila you makan tak sedap.
Doktor, saya punya culture kena makan nasi.
Zaman moden.
But at every second of your life you either earn or learn.
Batu Medic Show. Okey, selamat kembali kepada Lesung Batu Medic Show bersama saya Dr. Roland, dan hari ini kita akan bincangkan tentang satu topik yang telah dibincangkan di Dewan Rakyat. Telah ada statement keluar daripada Bank Negara di mana kita akan ada satu segmen of Copayment Insurance, bermakna selepas ni siapa yang akan mula ambil insurans selepas 1 hari bulan September, mereka akan ataupun mungkin dikenakan charge tambahan semasa mereka mendapatkan rawatan dan sebagainya. So bersama saya dua individu yang agak lama mereka telah berkhidmat dalam industri insurance. Bersama saya Mr. Teow dan Tuan Faizal. Apa khabar? How are you?
Good, thank you.
Baik,
Okay.
thank you.
Mereka ni pengalaman mereka collectively lebih daripada 50 tahun dalam bidang insurance. So saya bawakan kenalan ni. Ada yang memang terkenal secara peribadi melalui online dan sebagainya. Dan saya berterima kasih kerana you guys sudi datang. So saya nak mulakan dengan Tuan Faizal dulu. Saya selalu nampak you dalam TikTok. Tuan Faizal, boleh jelaskan sedikit tentang apa maksudnya copayment ni? Because ramai ada kegusaran di kalangan rakyat dan sebagainya that ni tiba-tiba akan membebankan sistem perkhidmatan insurans ataupun out of pocket, kena keluar duit ekstra dan sebagainya.
Betul. Terima kasih Dr. Roland. Pertama sekali you kena faham copayment ni exist berada di Malaysia ni
Dah lama.
sejak bila? Dah lama. So sebelum ni pun, sebelum keluar the statement of Bank Negara ni, dah existingly copayment. Dalam industri takaful yang saya familiar with industri takaful, kita ada another part of copayment yang dipanggil deductible as well. It's part also, dia salah satu juga adalah cabang daripada copayment. Okay, so copayment indirectly is meaning that upon you discharge daripada hospital, so there's a certain amount that you have to pay. I believe dalam circular Bank Negara sekarang ni dia berkata minimal 5% that you have to fork out your own money. So maknanya keluarkan duit sendiri untuk bayar amount daripada jumlah bil rawatan hospital. Selain daripada copayment tu, ada juga elemen-elemen like deductible. So itu adalah part and parcel of copayment as well. So dia sejenis copayment lah. Hopefully that clears off.
Okay. So yang bila dikatakan 5% ni, 5% ni, adakah 5% pada bil ataupun ada capping ataupun ada ceiling rate?
Okay. Ini bergantung pada how the product design by each of the ITO lah, institusi takaful operator, insurance dan takaful operator. So ada setengah product designer, dia design as such product, dia taruh ceiling. A certain ceiling of amount of the bill of hospital, then only then the copayment starts kicks in. I believe untuk yang Bank Negara punya ni, dia tak taruh in terms of bila akan berlakunya that 5%. Dia ada bagi example dalam some of the, kalau you tengok Google, dia ada buat some scenario. Ada setengah scenario if your total bill is 1,000 dan daripada 1,000 tu 5%. Ada setengah dia buat scenario RM100 daripada bill tu is 5%. Tapi I believe saya percaya bahawa untuk sustain dalam industri for the insurance dengan takaful institution untuk sustainable, so dia akan design satu produk yang sesuai untuk keadaan dia, keadaan sekeliling, sekitar, because there's a survey in terms of done.
Okay, so Mr. Teow pula, bila kita lihat pada situation macam ni kan, okay, contoh yang dibagikan Tuan Faizal bagi saya is sangat sikit, RM100, RM1,000. Tapi apa dalam situation that what if the medical bill is 100,000, 100,000 ataupun 200,000, and individu ni yang mungkin akan ambil, maybe young people baru tahu tentang insurance, baru introduce kepada insurance, mereka akan ambil premium pada umur mungkin 30 tahun ataupun 25 tahun, very very young policy holder. Okay, and then something berlaku, katakan ada kanser dan sebagainya, and then rawatan tu memang sangat-sangat tinggi, would it be 5% or would it be ada ceiling dia?
Okay. So as far as this co-insurance is concerned okay, number one, we need to understand, okay, when you buy an insurance policy, okay, it's a contract between you and the insurance company.
Okay, faham?
Okay, that is the first thing you need to know. Alright, the insurance agent is the one selling it saja. They are not a party to the contract.
Okay.
Alright. So to answer your question, so it depending on the contract. Okay, so if the contract, for example, states that if it is 5% or $500, whichever is more, okay, that is the condition.
Okay.
Okay, that's the minimum in that sense lah. Okay, for example, if you say that $500 or 5%, whichever is higher, then it's a different scenario. It's a contract in that sense. Okay, then you conform to what Bank Negara is making mandatory for the new policies. Alright. So as an example, if it's $500 or 5%, whichever is more. So if your hospital bills come up to 100,000, let's just say, okay, it happens. Okay, so you just apply the condition.
So kalau condition tu kata 500, bayar 500 saja lah.
That is, if it's the maximum 500, you bayar 500 lah.
Faham.
Okay, so this is where, okay, if it's the whichever is higher, then you got to pay the 5% because it's $5,000 lah. Okay, so depending on the policy contract, okay, that the insurance company design in that sense.
So satu benda yang sangat penting is also for kepada siapa yang memiliki insurance dan juga akan membeli insurance kesihatan, baca the fine print.
Yes,
Itu sangat-sangat penting. Betul tak?
correct.
So salah satu lagi kena senantiasa bertanya soalan pada ejen. Because sometimes ejen dia tanya soalan apa yang you perlukan, tapi mungkin apa yang you perlukan solusi dia tak sedetail yang you patut tahu. So itu you kena tanya.
Correct. So and the other thing is for competence on this subject, Mr. Faizal, right? For this particular subject, okay, a competent agent should highlight all these things. The contract, especially the excess clause, what covered, what not covered, and all those. Okay, and it is a good practice to inform the client. Okay, once you sign up, okay, you can what they call
Entitled.
you are entitled, or you can withdraw your contract anytime that you want. Or once you sign up and the policy is delivered to you, and if you're not happy with the terms and conditions, you can cancel off within 15 days without penalty, and the insurance company will have to refund you the premium.
So there is ada satu
Cooling period.
cooling period.
So that is very important. So it make it very clear to the client. Okay, there shouldn't be any misunderstanding or blaming any all party concerned. That shouldn't be the case. So you purchase, so you got to be very clear. Okay, now I have a co-insurance. Okay, if it's whatever. Okay, what I'm paid, what I'm not paid. All this must be clear in the sense. At least understand once only lah. Okay. In my experience, okay, much as we explain this to the client, all of them will forget lah. That is a normal thing lah, and they start calling us when normally they call.
Thing happens, need to be admitted to hospital.
No, when there are occasions when they call me when they're on the hospital bed. So this
Same.
is because this is insurance.
Because insurance ni hanya bagi saya dia akan jadi hanya masalah bila ada situation crisis.
Correct. When you
And
want
then
the claim
kebanyakan orang
saja.
tak review the policy.
Betul.
Correct.
It's a lumrah manusia. Dia tak akan nak tengok the detail apabila sesuatu tak berlaku pada diri dia.
Betul.
So bila dah berlaku pada diri dia, dia start digging up, dia start buka balik yang sijil-sijil lama, dia start nak tengok balik the terms and conditions lama. Tapi bila sebelum berlaku, dia tak nak tengok. Even my experience, I try to review back existingly the current punya sijil yang dia ada. Sometimes dia kata tak perlu because dia rasa dah okay.
Okay. So coming back to our today's subject of co-insurance, in a way, from experience, it won't capture the attention of the mind now lah, of the what until during the time of payment. Okay, because anyway we're talking about co-insurance.
Nothing comes out daripada pocket. Tak ada apa-apa yang akan keluar daripada
Nothing-
pocket selagi admission berlaku.
admission tak berlaku.
Correct.
Okay. Going to that, bila benda ni keluar dekat berita arus perdana, dibincangkan dalam parlimen, Timbalan Menteri Kewangan terpaksa also make a statement dalam parlimen berkenaan tentang isu ni, baru tiba-tiba attention was built lah. And kami sebagai rakyat, kita baru dapat maklum, okay, something is going on. Okay, mixed point daripada banyak pakar-pakar dekat luar sana is, ada yang kata bagus, ada yang kata they don't know, they tak clear sangat. Hala tuju direction ni tak clear sangat. Satu, ramai kata bila ada co-insurance ni, satu, the premiums boleh drop. Ada yang katakan premiums boleh drop antara 18 hingga 66%. Okay, satu. How is that going to happen? One, saya nak tanya, macam mana premium tu akan drop? Adakah dengan hanya 300-500 ringgit ataupun 5% capping ni, macam mana premium tu boleh drop, ataupun this will invite more people to take, untuk ambil health insurance? Because kita tahu at this moment sistem kesihatan ni dari segi pembayaran, sama ada melalui insurance ataupun rollback kepada penggunaan fasiliti awam ataupun fasiliti kerajaan, it's still a thing that has to be addressed. Kena address benda ni dengan segera. Some form of national system kena wujud. Adakah benda ni also, this will be a pave towards that? You answer this first?
Okay, first one is, in my opinion, okay, premium will drop. Okay, premium
macam mana premium tak akan drop?
Premium should drop. Okay, because a lot when come to the what we call, especially the family health insurance, a lot of claims come from what we call juvenile babies.
Okay.
As an example, a lot of claims comes in if you have what we call health insurance, baby go inside, 99% is high fever. Okay, so high fever, okay, when if you have this co-insurance, okay, high fever, the cost is smaller compared to chronic diseases or more serious disease. Okay, so on a volume basis, let's just say if the claim is 1,000 claim, so probably it become 900 claims in that per se, right? On that score, maybe it will drop. Okay, but okay, this in pursuing of national health insurance, I think it's a good idea. Okay, the minimum what is happening here is, okay, at least with this co-insurance subject coming up into play, it capture a lot of interest. There's a lot of discussion going on. That can become the basis of national health insurance, which is it's a very good what I call can come up with a very good system with all the experts. Okay, this, starting with this initial, this as the catalyst, the co-insurance as the catalyst. So you get all the experts to sit down and all those, and it can go into that. Okay, and what you call, and from there, right, it can spin off to much more. As an example, medical tourism. How to develop medical tourism?
I want to freeze you on the medical tourism. I want Faizal.
Okay.
Faizal.
Okay.
Bagi komen
terima kasih,
sikit
Doktor.
tentang
Okay. Saya punya komen senang je, because saya bercerita daripada pandangan sudut takaful. Takaful punya is different than insurance.
Terangkan sikit. At least penonton pun faham.
Untuk penonton semua faham. Yes, insurance, just like Mr. Teow beritahu tadi, is a contract. Dalam takaful is a kontrak juga, tapi akad dia bukan akad jual beli. Akad dia adalah akad donation, because we have a tabung called tabung tabaruk.
Okay.
So based on that tabung tabaruk, then the claims is being sucked up from there. So maknanya pembayaran semua daripada tabung tabaruk tu. Tabung tabaruk tu selepas tolak semua wakalah fee and whatnot. So that's the approach of
takaful.
Okay. So berbalik pada whether sama ada okay, untuk insurans dia akan bayar premium. Untuk takaful kita mengatakan caruman, because caruman ni adalah sumbangan pada tabung tabaruk tu. So caruman dia, saya tak boleh nak confirm dia turun. Sebabnya you kena tengok, caruman ni bergantung pada 3 elemen. Satu, you punya umur. Kedua, you punya pekerjaan. Ketiga, sejarah penyakit you ataupun you dah sakit sebelum ni. So caruman tu bergantung pada harga tu. So kalau you kena faham, audience kena faham, caruman dia bukannya akan turun RM100, RM50 and whatnot, because it all depends on you. Bila you ambil. Sebab dalam TikTok saya, if you have seen my live TikTok, saya selalu kata, ambillah masa muda sebelum anda tua, ambillah sebelum masa anda sihat, sebelum anda sakit.
Betul.
Sebab caruman tu akan meningkat as you go along, because risiko you bila semakin tua, semakin besar risiko you terhadap all this penyakit yang baru-baru datang ni.
Betul. So bila kita lihat pada impact sekarang ni, adakah dari aspek takaful, sekiranya the cake becomes bigger, then the cost akan turun? What is the number sekarang ni? Apa
Tidak
banyak orang
semestinya, tidak semestinya,
tak
because
semestinya juga.
bagi saya tidak semestinya. Kenapa? Because dia bukan tengok dari segi cake, dia patutnya tengok dari segi risiko dia.
Okay.
Because sekarang ni dah ada banyak penyakit baru. Even COVID pun masa mula dia keluar, tak semua insurance cover.
Betul.
Sebab diorang tak tahu to what extent is the cost, to what extent is the treatment gonna be like, kan? So sekarang ni pun akan ada penyakit baru. You pun dah ada viral viral fever yang baru. You dah ada sakit tikus kencing tikus tu and whatnot. So benda tu benda baru. So your punya cake tu tak memanglah nampak besar, but the anticipation of berapa harga yang akan digunakan untuk treatment tu tak tahu.
Okay, faham. Tapi my perspektif, saya punya perspektif, kalau dilihat dari conventional punya sistem insurance ataupun takaful kan, dia akan go to this macam rubber band, elasticity. Okay. Kalau kita lihat dari segi national data kita, 33% ada some form of life insurance mixed with a medical card dan sebagainya. 13% bergantung pada company ataupun syarikat yang mengambil insurance policy. Tapi itu pun kita tengok pada kategori company. Ada mungkin yang premiumnya sekeciput saja, RM10,000, RM20,000, and some of it have higher. Ni excluding of perkeso dan sebagainya. Okay? 10% ada kombinasi. Dia ada some form of mungkin takaful ataupun medical card sendiri, dan dia ada syarikat punya medical coverage. Tetapi 44% daripada population doesn't have a medical card. I don't think this data is even including kids and maybe yang mungkin suri rumah yang tak bekerja dan sebagainya. So I think the number is more. Mungkin this stat is just based on the working adults number. I think to be fair, I think that if based on all the chunking, this will be most likely the working adults. So kita ada satu situation di mana kos inflasi kesihatan is at 12.5% dikatakan oleh BNM. Okay, we accept that as face value lah. Tapi saya sebagai doktor perubatan yang tengok patient, yang prescribe ubat, prescribe drugs, know that the cost is just increasing day after day. And I will cakap kepada some of my patients, mungkin dulu blood test yang you bayar mungkin berharga RM500 10 years ago, today is RM1,000. Same thing. The same medication was mungkin RM40 dulu, sekarang dah jadi RM80, RM70 in like 5 years growing. So if you take like even a 12% annually. Tapi yang pelik pula, kenapa inflation dekat Malaysia sebegitu tinggi berbandingkan the global standard about only 5.6%. Apa yang hebat sangat tentang Malaysia ni yang inflation dia sakit? Adakah one big problem is kita ke arah satu aging nation? One big thing. And that thing I think we will elaborate a bit. We are going to an aging nation. Another one more thing is we are just a bunch of sick people. And this is dangerous if we don't, kita tak address benda ni dari segi I call it the health financing dynamics. You need quality healthcare. You tak boleh compromise quality mutu perkhidmatan kesihatan. Tapi at the same time, you cannot also compromise the cost. You cannot neglect the cost. You tak boleh shove the cost underneath the carpet and katakan that tak apalah, tak apa.
Okay, doktor, mungkin saya ada soalan pada doktor.
Okay, boleh. Shoot me.
This time saya tanya
bagus,
doktor.
bagus.
Okay. Based on berdasarkan you punya patient yang ramai you ada kan, berapa ramai yang sakit kritikal?
In situation saya, I would say at least 60% ada some form of chronic illnesses seperti sama ada masalah tekanan darah tinggi,
Betul.
ada masalah
so,
kencing
compared
manis.
to 10 years ago,
Lesser.
so adakah a bunch of people kita kat Malaysia ni dah banyak sakit?
Memang. Memang.
I rest my case because you jawab sendiri soalan
exactly.
you.
So we are seeing that there's the situation. Mr. Teow, you have anything to ask? Boleh je.
You see as far as this medical and all those are concerned, of course we are starting off with this co-payment and all those. I think it's very, very positive. Okay, it means there's attention given to this health insurance, national healthcare, things like that. Okay, of course, in all the countries that we know, okay, everywhere in the world, if you have the statistics, okay, the healthcare budget is always on a runaway train basis lah. Every country also like that lah. Medical inflation going up and then all these things. But one of the thing is, okay, it will continue to go up. So the whole issue is this runaway train. Okay, from the numbers that I was seeing, right, our Ministry of Health budget that was given to that I saw anyway, it was 32. Then after that, the following year was 36.
Now
and
40.
36. This year is 41.
Yeah, 41. Yep.
Okay, next year I am predicting it should be about 47. Okay, and then the following year you go accordingly, you times it accordingly lah.
But we still short at least 15 to 20 billion.
Saya pernah cerita dalam TikTok live saya, the cost of medical tak akan pernah turun.
Yes.
Sebab since day one saya rasa semenjak saya lahir pun it has always been naik.
Correct.
Tapi you kena identify sikit inflasi ada banyak faktor yang influence inflasi.
Yes.
So it's not only about people being sick and wants to spend, but it's also about other factors. Duit yang you bawa masuk untuk that services keluar ke masuk ke dalam Malaysia.
Betul.
So if a lot of it keluar, then maknanya starts the cost rising
You're right.
So absolutely correct. Okay, everywhere in the world is the same thing. In Malaysia, no difference lah. Okay, this is also a runaway train. Okay, now the issue is with this podcast and this what we call co-insurance issue that's attracting interest again, right? So one of the spin-off is my aspiration to see one of the spin-off to be prevention. How to prevent it? Okay, when I speak to some companies for that matter, they want to buy insurance and all this. That is the easy part. Okay, but when it comes to the escalation of cost every year, there's an increase of premium and all those. There's another one, they can afford it, no problem. Okay, but how to prevent your people, your employees, or yourself from getting sick? Okay, that is what you call a subject that should spin off from this.
But preventive is also sometimes not a measure to cure. Preventive is something like you try to avoid. But in effect, apa yang saya
preventive is to delay only. Okay, if you cannot, let's just say what we're trying to say as an example, we do not know lah.
Yeah. So berbalik pada isu copayment tadi. So copayment tu berdasarkan maklumat yang tersebar di media sosial and whatnot, dia mengatakan copayment ni adalah salah satu cara untuk prevent the escalation of the price of medical kan. Tapi pernah tengok saya punya TikTok live kan, saya kata dia takkan turun, dia akan sentiasa naik because there's a lot of other factors yang bigger chunk which playing a bigger role towards the cost of the medical cost. Tapi copayment is for the purpose of what? For the purpose of to have a yang lebih responsible, yang lebih bertanggungjawab in terms of you punya penggunaan of you punya medical card. So adakah you abuse ataupun menyalahgunakan you punya medical card untuk rawatan-rawatan yang probably bukan rawatan-rawatan yang emergency. So
I totally 100 bukan 1000% sokong tentang isu ni because kita dapat lihat this, bagi saya ini satu kelompongan lah.
Yeah.
Is a leakage. Saya salahkan banyak parti dalam benda ni. Saya salahkan banyak parti dalam benda ni. I want to whack this. Okay. Satu is the operation of medicine secara tersedia, operasi perubatan tu, rawatan tu. So di mana kita lihat kalau sesiapa yang ada medical card yang singgah ke hospital, apa yang akan berlaku is sometimes, to be all fairness, it's close discussion. Admit, then you can claim. If you walk in sebagai untuk rawatan konsultasi ataupun consult, you will not get you have to pay out of pocket. Insurance tak cover. So this cost one segment of inflation. Maybe out of daripada 100 orang tu, mungkin 60 orang betul-betul genuine. They have a crisis, emergency situation, some ruptured wound ke, cyst ke apa, terus rush pada hospital, they get emergency care. Another situation is there's the negotiation that goes on, that admit and then we'll run a diagnosis.
Tapi doktor tu satu thin line that you're talking about, because ada setengah orang sebab medical card ni adalah untuk membantu sakit, bukan saja emergency.
Betul.
So
betul.
Sakit sometimes you have to do investigation dulu.
Exactly.
So investigation memerlukan cost.
Betul, faham.
So tapi
some
bila
investigation,
bila you investigate, you tak jumpa apa yang sepatutnya you jumpa. So adakah cost tu patut pergi pada pelanggan?
Betul. Sangat-sangat I sangat setuju. Tapi masalah yang berlaku is the insurance company pun have what I define as macam jahit, keras kepala, where if they have like what Mr. Teow katakan, mungkin dia ada good repo, they have like incentive, you ada good BMI, you doing your regular checkup, and then your regular checkup goes into like sort of like a cross check with your premium. Sekarang ni ada AI technology and everything, so many multi-pronged approach boleh berlaku. Tapi bila masuk dalam situation like you're absolutely right, there's nothing, but seems to be some form a different diagnosis comes out.
Yes.
Just to cover this up.
Yes.
This because the patient said, I don't want to pay out of pocket, and it's adjusted. And this is going on. This is going on.
I do not want to comment on that.
You don't want to comment. I will comment. Because we see this. So when benda ni berlaku, that this trust berlaku, and there are situations when insurance companies conduct some form of inquiry, ada hospital yang lost their status with the insurance, and this has happened, and we can see this.
Dr. Roland, touching on that, sebenarnya boleh tengok viral banyak yang pelanggan-pelanggan claim GL dia tak approve. Kenapa? Sebab ada elemen-elemen non-disclosure kat situ. So kita dah ambil dah, even bank negara dah govern that part in terms of there's a 2 years more or less like a waiting period atau tempoh menunggu. Saya ada rasa dalam TikTok saya, tempoh menunggu 2 years tu to see whether there's internal punya penyakit dalaman evolve.
Faham.
So itu kita dah cuba ambil pendekatan yang terbaik untuk govern the whole thing. So yang abuse punya part yang in terms of collaboration dengan the hospital, itu kami dah cuba buat yang terbaik in terms of governing, tapi still ada loophole untuk ketatkan lagi. That's where copayment, I believe, it is the best.
This is one option.
Okay, you see when you're hospitalized, example, okay, there are two things here lah. There are quite a few things here. A lot of open-ended and all those. When you say closed-ended, okay, you are actually hitting the nail on the head. All right. Okay.
Not the years, huh?
Okay. So when a person is hospitalized in a private hospital, all right, and if they have a medical card, okay, and if they have co-insurance feature in the medical card or the insurance policy, okay, the purchaser of the insurance must be smart enough to understand this. Okay, if it's an emergency, it's a life-threatening thing, you leave everything to the private medical center to do whatever they want to do.
Fair.
Okay, but if it's not a life-threatening thing, or if the patient is conscious, as an example, okay, there are many things here in the sense that, okay, if the patient is conscious, they know what to do. But if it's a closed thing, right, then you are giving a free hand, you're opening a wallet for whatever test to be done.
I'll bust the card.
Okay, correct. So, but if it's a co-insurance thing in place, then, okay, I will be, if I'm the patient, number one, when I'm hospitalized, okay, I will want my daily bills first thing. I don't want to wait until 10 days later and all those I call, and hospital bill, and after that GL and all this and all those insurance company pay. No. You give me my daily bills. That's the first thing I want to do, because I'm a party to the payment, you see. Number two, okay, all specialists that want to come and see me if I'm not, or if my relative is inside there, okay, with my permission. Number three I will do is whatever test you want to do, okay, unless it's an emergency case, life-threatening and all those, okay, procedure that you need to go ahead. But if it's not life-threatening and all those, right, whatever procedure and test you want to do with my permission. Okay, so we are a partner to the insurance
Bipartisan
company.
lah. It's a bipartisan.
Correct.
Yeah.
So because why? Otherwise, okay, the hospital bills it can be 100,000, but it came into 300,000. So if it's if I need to pay 10%, it's 30,000. So I'm a party paying to it. So this is how the system work in the sense that, okay, if you have this knowledge, okay, with the co-insurance, then the insurance premium or the insurance claim will come down. When the insurance claim come down, then the onus is on the insurance company whether they want to reduce the claim or not. I mean, reduce the premium or not.
Lumrah manusia. Dia kalau kena keluar duit sendiri, dia akan more prudent.
Yeah, I think
we call that lumrah Malaysia. Yes.
betul. I think that prudency tu sangat-sangat penting. Mesti kena macam
You see,
they have to be cautious with spending.
Dia kena bukan berhati-hati, dia kena detail lah tengok.
see, even if the co-insurance in place, the education part on this lah, okay, the participation of the purchaser of insurance, if they're hospitalized, must come into play. Otherwise, it's nothing. Your co-insurance then is a close thing. We have cases. The guy broke his leg, okay, in a motorcycle accident. The hospital do an ECG. So if I am the one that no knowledge or no co-insurance, you want to do ECG, you do lah. But it has nothing to do with my broken leg. Okay,
But they will still do ECG lah.
They will still do an ECG.
Have to
Tak
lah.
nak komen tu because
Yeah,
sometimes
it's in a crisis situation.
bila you masuk, the first thing that doctor akan check apa?
Your
Blood pressure.
I will comment on it because it's from experience.
Understand?
Because selalunya bila masuk emergency, the first thing doktor akan check blood pressure. If your blood pressure suddenly shoot high, walaupun you ada tulang patah ke apa ke, dia akan still check benda lain. Sebab more or less doktor
Betul.
because you have to be concerned. You takut nanti you jalankan operation terhadap the kaki
Under-manage.
patah tu, and you under manage because you tak manage the expectation of dia punya heartbeat dia.
Betul.
So,
That one is true. Tapi what I think I want to just conclude that before we go to the next point kan. Dua benda yang saya lihat dalam situation ni. Satu is, you ambil senario macam satu orang ada mungkin terseliur kaki, tapi masuk ke dalam, tiba-tiba dia rasa murung sikit. Oh tak apa, kita boleh refer psychiatrist. Lepas tu psychiatrist datang, lepas tu kita akan refer medical, lepas tu datang 3-4 kali. So this thing
itu
ada satu issue
Takaful akan query.
Okay, Takaful can query, but sometimes the query is not going detail, because I feel there's one point that insurance companies will have undercover operations these days. I think maybe mereka dah ada dah. Sebab to justify the audit of not over manage, not under manage kind of thing, because kerajaan, dari segi aspek kerajaan, saya pernah bekerja macam Akta 5546, Private Healthcare Facility Services Act. Memang kita ada fee schedule. Harga ni buat surgery ni, harga ni. Kalau rawatan ni, consultation harga ni. Kalau buat bandage harga ni. Tapi bila I sesuka hati datang jumpa 3-4 kali one day, say, why is he coming for every 5 minutes then RM270, RM300, and then a small injury, I'm calling ENT, I'm calling this, I'm calling that on a Sunday, and then the harga naik tinggi-tinggi, lepas tu and then they start copayment.
Correct.
That will happen.
Correct.
If this is not done properly. Satu. Another one more thing ramai orang tak tahu is, bila ada insurance policy, and mungkin mesti katakan cool off 2 tahun tu dah habis, now you are 36, tiba-tiba ada rasa macam tiba-tiba ada bleeding dan sebagainya for female, pergi okay, scan, ultrasound, blood, admit, tapi rupanya something very small saja, tapi just with some tablet medication dah settle lah, tapi diagnosis is written something else, because physician ada power sangat. Okay, apa berlaku in the future, suddenly she goes and at 36 or 37, I think this policy is not good enough for me. I personally experienced that. I had satu policy sebelum ni, lepas tu when I was in my mid late 30s, I realised the policy yang saya ambil pada umur 27 tahun didn't match whatever the cost of healthcare sekarang. Because sekarang ni insurance ni coverage sampai berjuta-juta pun ada. And masa tu hanya coverage sampai 50,000 je. So it's like dalam 12 tahun tu I nampak perbezaan of the cost. And apa yang saya dapat pada umur 27 tahun, katakan something I nak gunakan kad tu, saya takkan dapat apa-apa coverage yang setimpal dengan the cost, the same value. Mungkin kena tambah RM50, tapi value I dapat untuk penambahan tu berlaku. Tapi apa yang berlaku juga, bila individu ni claim untuk satu disease, katakan tak ada cyst, tapi ditulis cyst. And for underwriters tengok, okay lah, 3,000 claim. It's stain. Maksudnya dalam rekod kesihatan dia telah tercatat ada cyst. And katakan pada umur 39 ambil satu insurance policy baru yang coverage mungkin 1 juta, 1.5 juta. Check dalam sistem, puan, coverage untuk cyst ni tak dapat.
Exclusion.
Excluded. And then stuck. They want to roll back, the policy dah full dah.
Yeah.
And then bila ada katakan tak jadi, tak apa. Kalau terjadi in the future, and dia kata they have to take risk, because dalam medical insurance ni apa-apa boleh berlaku. Apa-apa jenis kesihatan boleh berlaku. And then this one ramai orang tak tahu. Mereka fikirkan bila I ada ability untuk gunakan medical card,
Yes.
I akan whack maximum. Dia bukan whacking tu berlaku pada individu. Satu, berlaku dengan kerelaan individu tersebut.
Yes.
Sendiri yang memang bayarlah setiap bulan bayar 300, 400 as a premium.
So on that score, the co-insurer will do his part lah.
Yes. Tapi I think apa yang kita nampak pun, harga co-insurance tu akan tetap naik. They said they are starting at this number.
So from the circular what I read is, this is the minimum. 5% of $500 is the minimum. So at the discretion of the insurance company.
Okay, so it can go higher also.
It can go higher. So minimum, you cannot go lower than that. So in this case, minimum co-insurance is 500 lah. Minimum 500 is the minimum. So if it's 5% of 500, hospital bills come out to 100,000, then your co-insurance is 5,000. So minimum your co-insurance is 500 in this particular case lah.
Okay.
So it's clear. That part is very
clear.
Yeah.
Jelas.
Yeah.
Okay. Saya tertarik dengan apa Mr. Teow katakan tadi tentang health tourism. Okay, health tourism ni because apa yang kita lihat is the policies yang berlaku dekat Malaysia. Ini tak melibatkan polisi-polisi mungkin daripada luar negeri. Mungkin ada negeri-negara dekat dunia yang their insurance policy can be used almost like a worldwide kind of thing, because maybe rawatan kat Malaysia lagi murah, so they can cross over. I think Singapore pun ada certain policies di mana orang yang ada certain premium di Singapura boleh dapatkan rawatan di
I got to know Indonesia ni.
I think Singapore pun got certain
Okay, as far as the contract is concerned, okay, most of the policy covers when you buy the insurance policy, it covers you 24-hour worldwide. That sense
Really?
lah. Yes, most of the policy, unless it's specifically mentioned lah. But how they control this? There's a limit of your cover.
Okay, faham.
Room and board 200 or 400 or whatever. That is your entitlement lah. So you want to go Singapore, which is 3 times the cost. You want to go other place, Mayo Hospital, US. That is okay. Then NSSF fee sama. There's a limit to the cover. Okay. Then there is another 2 limit, the annual limit. Okay, or the limit, then there's another limit is sometimes they have a limit per convenience. So all these are variables. Okay, so as an example, when they cover you 10 million, when they cover you 10 million per year lah, okay, then you can be very clear, it's 10 million per year. But if they cover you 100 million per lifetime, but limit per cover per year is 1 million. So it's you can see the how they play with it. Okay, the hyping and all those lah.
I want to go back, jump into the question I asked again, medical tourism. Macam mana you lihat industri perubatan ataupun travel medicine ni boleh memberi any positive impact ataupun impact positif kepada copayment dan sebagainya?
co-payment
Tak ada.
impact. No, you see, as far as co-payment is concerned, okay, at this current moment we are talking about the Malaysian boundary. Okay, so as far as this, this what you call medical tourism is concerned, okay, well, there's no insurance contract in that per se lah. They pay from their own pocket. Okay, but of course, if they buy an insurance policy from Malaysia by a foreigner, then you can apply the co-insurance and implement whatever that you want lah. Okay, so at this current moment, medical tourism, there is no co-payment. Everything 100%. The co-payment is 100% from your own pocket.
So how does it help untuk travel? How do you help in terms of the medical tourism? How is this going to help?
Medical tourism, if this co-insurance and all this structured fee are concerned, and all these are put in place, and we are able to elevate our healthcare system. Okay, that is the one of the main objective that the government biggest headache for all countries is lah. So if they're able to elevate it to structured payment and all those, right, then the medical tourism can be developed. Okay, and the medical tourism can be developed, and at the end of the day, right, the medical tourism income can supplement or what they call stop the runaway train, or what they call contain the runaway train.
Soft landing lah.
Correct. And then as far as medical tourism is concerned, okay, it depends on the will of the government, because it's a trillion business. Every government wants to do it, but their big headache now is how to solve the current local terrain. Okay, then if the local terrain are already in place, okay, then the especially if you are in Penang, okay, a lot of Indonesian comes to Penang for treatment.
Yes.
Okay, and what I'm saying is, okay, in this very near future, a lot of Singaporean will come for medical treatment in Malaysia because the currency is so strong. Okay, so if we know how to capture this through this spin-off from this interest of this co-payment and all those local lah, this is local, okay, and our facilities can be elevated that way, okay, and then with this co-payment, then the insurance company of course need to if they can bring now with this co-payment, the objective to me, want to implement this co-payment, the premium has to come down lah. Okay, anyway now you got two products, everything is the same, but if you want co-payment, it's $1,000. If you don't want co-payment, it's $2,000. You choose in that sense. So the public has this what they call choice, okay, from the insurance point of view lah. But the spin-off is huge if the government is looking more deeply into it.
Betul. Faizal?
Pandangan saya a bit berbeza sikit lah, because you kena tengok a lot of other factors. First kali, the infrastructure needs to be ready first. Dari segi in terms
hospital.
You can count how many hospital. My mom used to work in a hospital, so kita tahu berapa banyak hospital, and it has always been there since for the past 30 years, 40 years, is the same amount of numbers. The only one yang baru keluar, Hospital Sungai Buloh, Hospital Sedang, is just 1, 2, 3 off from the state. But the numbers of berapa percentage of kenaikan jumlah manusia atau bilangan manusia di Malaysia, the percentage is higher. So kita punya fertility punya rate is tinggi kan. Banyak orang, ramai anak, sampai 7-8 anak.
Dah drop dah sekarang.
But
now have drop.
You look at the urban side, the suburban side, the kampung side, itu ramai. Still diorang percaya anak ramai mendatangkan rezeki yang banyak, rezeki yang murah. Okay, so that's infrastructure. Kedua, the first question saya akan tanya doktor ni.
Okay.
You dapatkan you punya ubat-ubatan daripada mana?
Luar negeri. Most of it, all the
But
drugs
does
are
it
all coming
contribute
from
to the cost of inflation?
Mestilah. Because kalau kita bandingkan dengan US dollar to ringgit, kita dah ada already impact
currency already.
You dah jawab dah soalan you. Macam mana you nak manage the cost? So ini sebenarnya you can berbalik pada Prime Minister kita yang awal dulu kan. Ada kontroversi. I do not want to mention names, tapi dia kan more or less contain the RM within Malaysia.
Okay.
Jangan keluarkan. Jangan keluar, because they try to limit the numbers of duit ringgit keluar Malaysia kan. Once duit ringgit keluar Malaysia, it starts to rise. Your purchasing power start to drop.